One of the biggest mistakes runners make if they have hip flexor pain or psoas pain, where they have pain in the front of their hip, is that they continue to strengthen the hip flexor. The problem with this is that the hip flexor is already overworked, it's overloaded, it's an overuse injury, so we actually have to take load off of the hip flexor. So strengthening it is only going to make your pain worse. Now, in order to do this, we need to open up the hip, work on that hip mobility, and we also need to strengthen the posterior chain, like the glutes, specifically the glute max, the gluteus medius, and the hamstrings. Now, I love to open up the hips as I'm stabilizing them, so I'm going to place a resistance band around my knees, and you're going to take your knee out to the side, then bring it back behind you and back down. So from the side view, it's almost like a fire hydrant going back behind you into a donkey kick, and then back to starting position. Now, when I'm doing this and you're bringing it out to the side, make sure you're not bringing it forward and out to the side, because that's just going to allow the hip flexor to contract. We want to turn it off in this position. So make sure it's out to the side and even a little bit back, then behind you and down. It's a very small circle, and we're just working on that back part of the stability into that lateral stability and posterior stability. For the last exercise, you're going to place your foot and your back heel against a wall or a block. You're going to get in a split squat position. Now, all I'm going to do in this position is drop down into a split squat. That's the first progression. And then if I want to progress it even further, I'm going to twist towards my front leg. So as I'm coming down, I'm rotating towards my front leg and I'm coming back up. This is a great way to work on that glute max and glute med contraction, as well as the quad. And when I'm rotating towards my front leg like this, I'm getting into more hip internal rotation. So another great way to work on that hip mobility and glute max contraction.